Today's topic is imaging modalities in prostate cancer.
In this presentation, we will discuss what is prostate cancer, the challenges posed by diagnosis, and diagnostic imaging modalities. Do you know anyone who's been diagnosed with prostate cancer? If so, you understand its devastating impact and wide-reaching effect on numerous men diagnosed with the condition. Prostate cancer is a cancer that starts in the prostate gland, a walnut-sized organ surrounding the urethra just below the bladder in males. The disease is characterized by the uncontrolled growth of PSA, a protein secreted by prostate cells. Studies have shown that expected normal value for PSA increases with age. This table illustrates the normal ranges of PSA by age. However, it is important to note that PSA levels differ slightly with factors such as race. A PSA test is the first step in diagnosing prostate cancer as it indicates the need for further examination.
There are multiple challenges faced by the diagnosis of prostate cancer. Firstly, there are no symptoms for early stages of cancer. Undergoing diagnosis can result in unnecessary overtreatment, leading to potential complications and harmful side effects such as infection. For instance, a PSA level can read false positive result whereby there is an elevated PSA level but no cancer. Chronic inflammation of the prostate gland can mimic tumors, making it difficult to detect. Gland size also varies among individuals. Different significant sampling error may occur in men with large glands, and more biopsies may be needed under these circumstances. PSA levels are higher in men with larger prostate glands. The PSA density is sometimes used for men with large prostate glands to try to adjust for this. Prostate tumors are multifocal, meaning that they can be in more than one area.
Imaging plays an important role in the non-invasive detection, localization, grading, and staging of prostate carcinoma. MRI has become a powerful tool to achieve all these goals. If a PSA test shows any indication of prostate cancer, a transrectal ultrasound biopsy is the next step in diagnosis. If it is suspected that the cancer may spread beyond the prostate gland, imaging tests including CT, MRI, and PET scans may be recommended.
MRI is natively superior than CT and other imaging techniques. In both CT and MRI, image contrast is a function for tissue density. For MRI, the source of signal are protons. Additionally, tissue relaxation properties impact image contrast in MRI. There are two types of relaxation properties, T1 relaxation and T2 relaxation. During T1 relaxation, protons reorient, resulting in the recovery of longitudinal magnetization, helping differentiate post-biopsy hemorrhage from the tumor. In comparison to T2 relaxation, protons dephase, resulting in the decay of transverse magnetization, hence providing high-resolution images that clearly define prostate anatomy. In some cases, endorectal coil is used to help provide more detailed images.
MRI is clearer than CT and uses non-ionizing radiation. However, movement can ruin the image. It is difficult to distinguish inflammation from tumors, and if endorectal coil is utilized during the procedure, there is a risk of rectal damage.
TRUCE, transrectal ultrasound. A transrectal ultrasound is a real-time technique that is used for early detection of prostate cancer using sound waves to produce 2D wave pictures of a man's prostate gland. A prostate biopsy uses transrectal ultrasound imaging. A core needle biopsy is the main method used to diagnose prostate cancer. The procedure involves a tissue sample that is taken from the prostate using several small needles inserted into the rectum, where abnormalities are detected. However, a GP would not recommend a biopsy without strong indications, as it is an unnecessary invasion, resulting in a small amount of bleeding from the rectum, causing soreness. Transrectal ultrasound is of low sensitivity and poor localization.
There are numerous future applications involving TRUCE. For instance, color Doppler scanning is used to enhance the diagnosis of prostate cancer by increasing sensitivity of the ultrasound and improving specificity of biopsy findings. Color Doppler detects abnormalities by looking at blood flow patterns. It makes prostate biopsies more accurate by helping to ensure the right part of the gland is sampled.
The pros include non-invasive, safe as it doesn't use ionizing radiation, and provides real-time imaging, which is good for guiding a biopsy. However, cons include bleeding, infection, urinary difficulty, and resolution of color Doppler is 1 mm, whereas the diameter of prostate cancer microvessels is smaller than 50 micrometers. This limits the detection of low flow velocities, although this has been partially overcome through the use of power Doppler ultrasound. Power Doppler has been shown to achieve higher sensitivity than color Doppler in prostate imaging, but there is no significant difference in the specificity for cancer detection between the two techniques. Careful ultrasound evaluations, including black and white as well as color Doppler imaging, are important in determining the size and the location of a tumor.
Prostate biopsy is a relatively straightforward day procedure. It's either performed in hospital under sedation or in the rooms under local anaesthetic. The process involves use of an ultrasound probe where we take very small specimens from the prostate. It's also important to emphasise that I take finger-guided prostate biopsies of any abnormality that I can feel in your prostate. Therefore, if we feel something abnormal, we specifically target it. And this is something that the ultrasound probe can't do. By doing this finger-guided prostate biopsy, we increase the chances of finding a prostate cancer if it's there and finding it early.
In some instances, MRI truss fusion is used to enhance prostate depiction. The relatively poor image quality of truss and reliable images of MRI are combined, allowing for a real-time, more accurate image. The process involves an MRI prostate image to be obtained. Using fusion technology, the MRI is fused with a live transrectal ultrasound by the urologist who performs an MRI truss fusion biopsy. The fusion results in a three-dimensional reconstruction of the prostate, allowing biopsy sites to be recognized. Results using a fusion device are very promising.
The image to your left illustrates a T2 weighted MRI fused with real-time ultrasound and color map. The top right image shows real-time ultrasound, whereas the bottom depicts MRI before fusion took place. Fusion can be performed within minutes. However, the prostate seen by the doctor on real-time ultrasound will never exactly match the MRI scan, since different angles of the patient movement can reduce accuracy.
CT uses a series of X-rays in slices to obtain images. The role of CT in the diagnosis of prostate cancer is limited, because most images produced are better with an MRI scan.
CT scans are quick and painless. However, as previously stated, they are not as clear as MRI and come with an increased risk of cancer in the future due to the exposure of ionizing radiation.
PET scans generally measure elevated glucose levels. However, prostate cancer is slow growing, and as a result, the glucose levels are unlikely to be successfully measured because of the slow changes in glucose metabolism. This means that even if the cancer has spread, the PET scans could very well miss it. They are not as clear as CT scans and MRI, resulting in trouble localizing the exact spot of augmented activity. Therefore, it is not commonly used for detecting prostate cancer. PET scans show low spatial resolution, and it is usually performed in combination with CT for better accurate anatomical localization.
In summary, MRI produces reliable images. Although TRUS has low sensitivity, it is enhanced using color Doppler. PET scans are not as clear as CT and MRI. However, MRI scans are better than CT scans in prostate diagnosis. Current imaging modalities have excessive significance for clinical application in the detection and diagnosis of prostate cancer. MRI and TRUS are of value in the evaluation of tumor extent and staging of patients. They guide needle biopsies and play an important role in the management of patients. However, additional clinical studies are necessary to prevent the exposure of unnecessary harm when diagnosing prostate cancer in its early stages.